Are you feeling overwhelmed about sitting the MRCGP SCA? You might feel that this is a daunting exam due to the uncertainty, the wide curriculum that you need to cover, having to perform under exam conditions. Working smart is really important. You don't want to just work hard, just practicing cases here and there. You want to work strategically. This is where a lot of GP trainees don't have a system to follow. When I say working smart, what I mean is that take your exam seriously, decide which sitting that you're going to take the exam, reserve it, and start planning at least 6 months before the exam. Make sure that you're using your exam leaves, you're using your study budget, because you've got that to use towards your exam if you want to. If you don't use it, then you're going to lose it. So make sure that you're proactive at organizing things. Identify your blind spots and areas of weakness. For example, if you're not very good at sexual health or gynae, then you could consider arranging a half-day release at the gynae outpatient clinic. You will get some experience. Give yourself ample time to embed consultation skills. Seek regular feedback and make sure that you keep adjusting your consultation. Another thing that's really important that some GP trainees know they should be doing, but they are not doing, is record your consultation. So you have got cuts that you need to do, you have got audio cut. Why don't you use it at the same time as you're preparing for your exam? So you're killing two birds with one stone. You have to do it anyway. So do it and use it for your SCA and target the cases in the clinical experience groups and look at what are the areas of weakness you might have and do some recording, and that will help you to analyze with your supervisor. Join a study group if you can with other trainees. Ideally, you want to join a study group with other trainees who are sitting the exam at the same time as you. If you're joining a study group with somebody who's sitting the exam in February when you're sitting it in November, for example, they might not be at the same pace as you and might not take it as seriously as you. That's why you want to have somebody who's taking it at the same time. Sometimes GP trainees struggle to get good study group going. I understand it can be difficult when everybody is busy, but it's effective. Organize joint consultation with your trainer. This is an opportunity for you to learn to manage risk and uncertainty from someone who is more senior. They might have some pattern recognition. They might have some tools that they share with you. And then develop your skill at managing complexity. This is where you expose yourself to complex cases. The structure is really important. Make sure that you develop your own structure. I share with you a structure that I use. So in the 3-minute reading time, it's really important that you prime your case. In the first minute of the consultation, encourage the simulator to tell you the story. They've got a script, and if you ask open question, you will get most of the story out there. If you don't do that, or if you interrupt them in the first minute, then you'll have to work harder to get the story because you've cut them off. So make sure that you listen actively to what they're saying. Then at around 1 minute to 2 minutes, elicit the patient's idea, concern, expectation, because you want to know what's in the mind so that you know how this consultation might develop. Then think about the medical history, how you can come into working diagnosis, explore what's the issue. Don't forget your red flags. Then think about how is this illness impacting on your patient's life. So the patient is also a person and has got other work life or home life. So make sure that you elicit that as well. Common mistake I see is GP trainees just asking, who lives at home with you, or do you smoke? These questions are very formulaic. You don't want to ask formulaic question. It's better to ask it in context. For example, how is this headache affecting you? Have you had anything that you had to change because of this headache? So you're asking this question that's putting it in context with the headache. Are you struggling with your consultation skills? Maybe you need help and you want to get constructive feedback. If you'd like to get help, then click the link down the description below to see whether I can help you. If I can help you, then we can enroll you on the one-to-one coaching program. Once you've got the eyes, you've got the medical history where you can come into working diagnosis, and you've also got the situation as in the context, the psychosocial, then it's time for you to move to clinical management. It's very important that you get mutual understanding with your patient. If your patient is worried about brain cancer, but you think that the patient has got migraine, it's important that you get on the same page. Because do you think a patient who is worried about brain cancer is going to be open to listen management of migraine? They need to know that you have listened to them and you readdress their concern. So you might tell them, I appreciate that you were concerned about a brain cancer. Having listened to you today, I don't think this is a case because when I asked you various questions, you do not have any symptoms that's concerning. However, what I think you've got is migraine because you're having this headache on the right side and also been having some nausea and sickness. What do you know about migraine? So you see how readdressing the patient's concern and explaining what I think is going on. So the patient feels understood. They feel that you have not dismissed their concern. Then when you discuss the management of migraine, they'll be more open to listen to what you have to say. So then in the clinical management, I might say to the patient, I understand that you are hoping for a scan. We don't normally arrange scan for migraine. It is a diagnosis that we can make clinically. Actually, arranging a scan for you might actually be against your interest because you might get unnecessary radiation that could increase your risk of cancer. But I can tell you what we can do to help with the headache that you've got. I understand you've tried paracetamol, it's not working. There's a more effective treatment called sumatriptan. Would you like me to go over this with you? So you see how I'm progressing the consultation? So I've readdressed expectation as well. And I'm explaining what we can do to treat this headache. So then you have to discuss not just the medication, but you have to also explain how to take it and the side effects. And also you might consider any triggers. You might want to tell the patient whether they could keep a diary of the headache and arrange a follow-up in 3 weeks' time to see how they've responded. Lastly, you want to make sure that you're safety netting the patient. Because you're worried about a brain cancer, you might tell the patient what are the warning symptoms to look out for. So once you've done that, then you're showing that you're consulting at a level that's above or even higher than the standard. If you found this video useful, then I'm sure you're going to get a lot from watching this video. Click the video to watch it. Take care, everybody. Bye-bye.